Hello, my name is Kaylee Nelson. I'm going to be your student nurse today.
Okay.
I'm just going to wash my hands and provide you privacy, and then we're going to get started with your head-to-toe assessment.
Okay.
Wash my hands. Alrighty, and can I have your name and date of birth?
Jessica Pittman, March 16th, 1996.
And do you have any allergies, Ms. Pittman?
No, I don't.
Okay. Check that with my chart. That is good. Okay, your overall appearance to me looks well. You are talking to me. You're oriented to place and time. Your color is well. You're looking at me. You're able to speak. So her orientation is well, and she does not need any further assessment for a coma scale or a mini mental exam. I have already taken her health history, her weight and height, so now I'm going to do her vital signs. So I'm going to do your pulse. Okay, great. I got 88, and I also did your respiratory rate while doing your pulse, and I got 10 for that, so that is slightly low. Are you feeling okay?
I think
Do you have
so.
shortness of breath?
Not too much.
Okay, we'll just
I'm
keep
good.
an eye on that throughout
Yeah.
the video. So like I said before, I already did her height and her weight previously before she came in the room. Her level of consciousness as well, she's sitting up, she's not fatigued or anything like that, so her level of consciousness as well. She's oriented to person, place, and time, and her mood is also well. So we're going to go ahead and I'm just going to list off the cranial nerves before we get started with her head-to-toe assessment. It is olfactory, optic, oculomotor, trochlear, trigeminal, abductans, facial, acoustic, glossopharyngeal, vagus, spinal, and hypoglyceal. Okay, so now I'm just going to finish with your blood pressure.
So I take off my clothes now. Yeah.
I used to live in Orange, but I don't remember ever seeing any place called Dogwood.
Okay, 120 over 80, which is very normal. Perfect, actually.
People wanted to hang out with like McDonald's was this spot on a Friday day.
Alright, clean up my materials.
Basically public garden parties.
Okay, so now we're going to inspect your head and your hair, your scalp and your hair. So I'm just going to put on my gloves. Okay, so I'm just going to touch through your hair, okay?
Okay.
Alright, I see no knits. Her hair looks clean. The color's throughout, no balding spots. Her hair has no dandruff in it, and if there was, I would assess to make sure that it comes out easily and that they're not knits. Alright, now we're going to assess your eyes, okay? So if you can just close your eyes real tight and open them. Okay, good. No lid lag is what I'm assessing for. And if you can follow my finger.
And like, I really like the 111 schedule because I wanted the same as every other question. Like I looked at the schedule, like 5 questions, and it was 2 points.
Okay, and follow my finger in.
126 makes so many points. And they
Okay,
don't
good.
even give you credit.
Her eyes are both going symmetrical. There's no lagging of either eye. So now I'm going to measure your pupils. Her pupils measure at about a 4. So now I'm going to test the reaction of your pupils. So just look straight at me.
then she added in the short answer, my grade 1 people, and I was like,
Okay. Her pupils are both reactive to light. Alright. And do you wear glasses or contacts?
I wear glasses.
Do you wear them for reading or just reading?
Just reading.
Okay. Do you need them for up close then?
Yes.
Okay, and when was your last eye exam?
2 weeks ago.
2 weeks ago? Great, so because it was so short ago, we don't need to do the Snellen chart. So I'm just going to pull down to inspect your sclera and your conjunctiva, so when I pull down, you can look up for me, okay? Okay. Her conjunctiva is a pink color, and her sclera is white with a little bit of red running through it. It just looks kind of bloodshot. So now I'm going to use the ophthalmoscope to look in her eye to see the back of her eye. Okay, and I'm looking for an orange color, which I do see. Alright, so now we're going to do your ears. I'm going to inspect the outside of her ears. They look good. Since she has piercings, I would also look at her piercings to make sure that there is no redness or infection. And in both ears, I see no wax buildup or no hair, which looks good. So now I'm going to use the otoscope to inspect her tympanic membrane in both ears. Put the cap on. I see the cone of light. Cone of light also on this side. There's no redness or wax buildup in the ears. Alright, do you have any pain in your ears?
No, I don't.
No pain? Okay, great. Alright, so now we're going to do the whisper test.
Side rail. Feeding tube.
Alright, her whisper test is great in both ears. So now for your nose, we're going to do your sense of smell.
I smell alcohol.
Good, okay. Alright. And her nose is symmetric. It's not to either side. Now I'm going to inspect the inside of your nose, so if I can just have you look up. Alright, nothing is blocking the inner nose, and her septum looks straight, not deviated on either side. And then for your sinuses, frontal, ethmoid, maxillary. And they don't feel, I can't feel anything, so that means that they're not swollen. So now I'm going to do your mouth. Her lip color looks moist and pink, and there's no cracks, ulcers, or anything like that. So I'm going to look inside your mouth. You can open wide. Her oral mucosa looks pink and moist, and if you can say ah. Her tonsils and her uvula are good. Her uvula is centered, and her tonsils are barely poking out on the side. They're not swollen or anything like that. And do you have all of your teeth? Okay. And do you go to the dentist regularly?
Yes.
Okay. So now for your tongue, move it side to side with the gauze, and I would throw that away. And then if you can just swallow for me. Great. Okay. And do you brush your teeth twice a day?
Yes.
Do you floss? You do. Okay, great. So no teaching is needed for that. So now I'm going to inspect your neck. So we're going to do your lymph nodes. None of them are swollen, and now I'm going to do your thyroid. They're not swollen either, so no other indications are shown that I need to do further tests on that. Your skin is a nice color. It's a little cool, but she may be a little cold. Are you cold?
Just a little.
Okay, so that is why her skin is cold. Her skin is a nice color, even throughout, a little pink, but she's very pale, so that is most likely why. No, it's symmetric throughout. There's no lesions, bumps, burns, bruises, anything like that I'm inspecting for. Now I'm going to do your turgor. sugar is good. I see no signs of dehydration, so I'm going to check for edema, which is swelling. Her edema is good. No edema. And your nails. There's no clubbing of the nails. On either hand, her capillary refill on both hands is less than 3 seconds. And do you use any skin moisturizers or lotions or anything? You do? Just when your skin feels dry?
Yeah.
Do you have dry skin?
No.
No? So you just use it when you need it?
Yeah.
Okay, so she just uses lotion as needed. Alright, so for your respiratory, she's just breathing on room air. Her chest, when she rises, looks symmetrical. There's no fall on either side of the lungs. So now I'm going to percuss.
Not so much. Take a note.
Percussion sounds good. So now I'm going to listen to your chest, okay? Okay, so you can take a deep breath in. Okay.
Opposition? No? Yeah. Is it rotation of the thumb around its own axis? Move it of the thumb across the palm to touch each of the fingertips so we see how it is.
Okay, I'm just gonna go under your shirt.
That's such a weird word for this. It is. So it's kind of like an opposable thumb. Okay. So then that's it for your hand. I mean, because I know that.
Okay.
Because like there's some.
The frontal side of her body sounds good. No wheezes, no rhonchi or anything like that. There's no sounds that I cannot hear, any diminished breath sounds. So I'm gonna do the back.
Abduction, flexion. And then if you wanted to hip, you would like
Again.
you bring it out for abduction.
Again.
Over for
And again.
And then
And I'm gonna go under your shirt.
bring it out for flexion.
Again.
Bring it down for extension. And then that's basically it. So then for your knee, you would extension. You can't really bring your kneecap in. Yeah. That's pretty. That's good as far as that.
And again, on the posterior side, I hear no adventitious breath sounds, no wheezing, no bronchi, no rails, anything like that. I hear no diminished breath sounds. They're all strong, clear, good. So now I'm going to. Did you have a smoking history? Have you ever smoked before?
No, I have not.
You have not smoked
No.
before. Okay, so I have just 2 more tests to do for your respiratory system. Put my hands like this on her back, and can you take a deep breath in?
Plantar flexion, dorsiflexion.
Okay.
Like roll it. Or roll it.
And can you say 99?
99.
Immersion.
99. 99.
Extension.
Okay, everything sounds good for that. So now I'm going to do her heart sounds. Okay, so first I'm going to listen, and then I'm going to check for her color and skin, which sounds good, and then I'm going to do her pulses. Okay. Okay. Aortic.
Just always make sure that you're supporting the joint, not just. Forward,
Pulmonic.
cover the patient. Just cover. Make sure each side.
Tricuspid.
So you always make sure to let them know.
Just going to come in your shirt here. Herbs point. And I'm going to come under your shirt here for the mitral. Okay, everything sounds good. I hear no bruits, no extra heart sounds. I hear the S1 and the S2 where I should. So now I'm going to check for our pulses. Okay, so we're going to start with the temporal.
I feel a lot more calmer about this general though. I remember the first time we did.
Good. The carotid one at a time.
Yeah.
Okay, and I'm going to go under your shirt to check your apical.
I feel really confident about that.
And I'm going to check your
I felt
brachial.
very confident going into catheter. I didn't feel. I wanted to do this one because yeah.
your radial. Okay. Again on this side. Brachial. And radial. Okay, and then I would also check the femoral first, but we're going to skip that. So now I'm going to roll up your pants to check the popliteal. Okay, feel that. And I'm just going to take off your shoes to check your dorsal. And I also have to take off your sock, okay?
Okay.
Okay, so now I'm checking for your posterior tibial and your dorsalis pedis. Okay, and I would again check on this side of her leg for the same pulses. Your color is good. I've already checked your capillary refill and your edema. And I think that's it for you today, ma'am, okay?
Okay.
So I'm just going to lean you back, pull up the side rails, make sure the bed's lowered, put the call bell in, wash my hands, document my care, and come back later to check on her.